Now, scientists have developed a simple blood test that could soon be used to detect a woman's risk of breast cancer. Researchers at University College London have discovered that some women who develop the disease without having any family history have a particular marker in their blood. They believe this would show up in tests several years before symptoms appear. Well, I'm joined in the studio now by Professor Martin Widschwendter, who is head of the Department of Women's Cancer at University College London. He's also led today's research. Welcome. Thank you very much indeed for coming in. I mean, it sounds like congratulations are in order. How big a step forward is this?
I think it's a very big step forward, although it is not the end of the story. It provides a very good proof of principle that by looking at what we call the epigenome, we will be able to predict the risk for breast cancer and probably also for other cancers years in advance of diagnosis.
So just talk us through in quite basic terms, if you can, exactly what you found and how it works.
Okay, so we know that the genome plays a major role in cancer development. We know that women who inherit a faulty gene, which we call BRCA1 or BRCA2, something that Angelina Jolie has, is putting women at very high risk to develop breast or ovarian cancer. But that is only true for 10% of women with breast cancer. 90% of women with breast cancer develop this without having inherited this faulty gene. So if you look into the genome as the hardware of our cells, then you can look into the epigenome as the software. So the software is actually programming a cell and is crucially important for this function. And we have discovered that by looking into the defects of this programming, of this false programming of the epigenome, we'll be able to predict a woman's risk to develop breast cancer years in advance of diagnosis.
So how many years away from having that blood test capability do you think you are now?
Okay, so what we have provided is a proof of principle that misprogramming of the epigenome allows us, in theory, to predict this risk. What we need to do now is to further develop these tests. We are pretty sure that we've not looked into the most appropriate cells, which we have looked to our blood cells. I think what we need to do is to look into cells which are more like epithelial cells of the breast. And those cells will probably be able to predict the risk much more accurate than the current blood tests. We've also looked only into a very limited amount of these epigenetic features. We have now the opportunity to look into more than 500,000 of those features. So those combinations together, looking into cells which are epithelial and ideally epithelial cells which are hormone sensitive, like the cells which we get from cervical smears, in combination with a higher number of these epigenetic features, will probably lead to a breakthrough. And I would say in 5 to 7 years' time, we will know whether this is really true or not.
So potentially you could be on the brink of something pretty huge. This will also impact on the way that on research into other forms of cancer.
Exactly. So we are in the process of forming a large consortium, not only to predict breast cancer using this principle, but also other women-specific cancers like ovarian, endometrial, and cervical cancer. So all women-specific cancers, which we know are triggered by hormonal exposure, various lifestyle factors, etc.
Really interesting talking to you. Thank you very much indeed for coming in. Thank you.